Welcome to CS Prep. For CS, there are general questions that everybody knows, and there are specific questions that lead you to the diagnosis. So, what I'm going to focus on right now are the specific questions. So, for pediatric cough, the differentials are laryngitis, pertussis, croup, foreign body, epiglottitis, retropharyngeal abscess, asthma, and bronchiolitis. Let's see how we can rule them out by just asking questions. So for laryngitis, you ask, is there any change in voice that refer you to laryngitis? For pertussis, you ask, is there any runny nose, watery eye, vomiting? All of these refer you for pertussis. For retropharyngeal abscess, is there any high fever? And the most important question to ask, is there any problem moving your neck? For bronchiolitis, is there any difficulty breathing? Is there any fast breathing? For asthma, you ask, is there any allergies? Is it related to timing or activity? If it's related to activity, then most likely exercise-induced asthma is very high yield for CS. For epiglottitis, always remember the 3Ds: dysphagia, drooling, and dysphonia. Dysphonia, we're already going to ask about it, change in voice and laryngitis. The two most important things to ask about too, is there any difficulty swallowing? Dysphagia. Is there any drooling? That's epiglottitis, immediate intubation. For foreign body, how did it start? Did it start suddenly? That's a foreign body, so we gotta do bronchoscopy right now. For croup, you ask, is there any sound with coughing? What do we call it? Stridor. So if there is, you better prepare your epinephrine and dexamethasone. After we ask all of these questions and the general questions, we're going to talk about it in a separate video. We do physical exam, which is HEENT, cardiovascular, and lung exam. And then we order the labs. The most important one is the CBC and the blood culture, plus the x-ray of the neck and chest.